Hello, everyone, and welcome back for Season 2 of the Wellness on Purpose podcast. Here at the Wellness on Purpose podcast, we appreciate that there is no linear path along one's wellness journey and understand how easy it can be to get caught up in the latest health trends found on social media. Our intention is to provide you with impactful, educational, and realistic information to help you progress on your journey to live wellness on purpose now and for future generations. Hey guys, welcome back. It's Marissa here, and today I am bringing you another amazing practitioner from Kawartha Care Wellness Center in Lindsay, Bala Sundaram. Bala is an experienced physiotherapist who assists patients through examination, comprehensive education, and treatments, which enhances faster recovery with their injuries and conditions. He works with patients to assess and treat musculoskeletal conditions, vestibular rehabilitation, and concussion management in all life stages. In this episode, Bala talks about the importance of posture and alignment, the problem with waiting to address pain and inflammation, and he shares his 3 foundational pieces to a healthy lifestyle to reach longevity. So if you're ready to enhance your wellness journey and see if a physiotherapist is suitable for you, stay here and take notes. Welcome, Bala. Thank you so much for being on the Wellness on Purpose podcast today. How are you?
I'm good, thank you. How are you, Marissa?
I'm good, thank you. Thank you for joining us. I'm so excited for our community to learn more about how a physiotherapist can help support their wellness journey. So how about we dive right in and you tell our listeners a little bit about yourself?
Yeah, my name is Bala, and I am a registered physiotherapist in Ontario. I practice in Kawartha Care Wellness Center at Lindsay, and I love to treat my patients with difficulty in walking, difficulty in moving the shoulder, and having pain in there. I pretty much treat all ages and all the body parts, okay? And I use mainly exercises, education, and manual therapy. Yeah, that's my area of interest and expertise.
Fantastic. So what led you to pursue a career in physiotherapy?
Frankly speaking, it was an accident actually. And one of my friends told there is a career called as physiotherapy. Then I started researching and exploring about that. Then I got interested in that. Then gradually I got more detail from my family members, friends, and other healthcare practitioners and other physiotherapists. Then I got into that profession. Yeah.
Amazing. And where did you study for physiotherapy?
I studied my physiotherapy in India, southern India.
That's amazing. So when you studied in India and then came to Ontario, Canada, was it the same certification and credentials, or did you have to do any additional training when you arrived in Canada?
That's a good question. So fortunately, physiotherapists are not needed to do any additional credentials here in terms of additional schooling or anything, because the credits, whatever we earned back home, they are accepting here. But we have to write the exams like other Canadian physiotherapists. After the school, they have to write written and practicals to get the license to practice as a physiotherapist in Canada. The same thing we have to do. Yeah.
Okay. And do you have to continue to do different certifications as a physiotherapist, or is it just as you desire based on looking at different niches to take additional courses, or is it something that's mandatory?
Yes, it's not mandatory, but every year we have to complete certain courses as per the college, but it's up to us. It's based on our interest. We can upgrade ourselves. For example, like I am keep on upgrading myself in musculoskeletal physiotherapy by attending some manual therapy courses. And also I have done tons of courses in vestibular rehabilitation, concussion management, like that. So it's up to us, physiotherapists. We can go and upgrade ourselves by attending some courses. But college is recommending us to at least 2 courses we have to do every year, but we can select whatever course we want to do. It's not mandatory, yeah.
Okay. And you mentioned that you treat many different patients. So anything from injury to prevention, children. Would you say that there is one specific common ailment that you address a lot in your practice?
Yes, mainly the condition wise, otherwise the body part. If you take, I see a lot of back, and next to that I see knee, and next to that I see shoulder. So this is what I had seen in my 7 years of practice in Canada. Lots of back, mainly I think because of the back. If you see the middle age to the seniors, they are coming with lots of back injuries and back conditions. Especially the seniors will be complaining about their knees a lot, maybe due to arthritis or climatic conditions and other things may influence that. And shoulder, of course, shoulders are common in the young people as well as in the seniors because of bad posture and like lack of physical activity or exercises. Children I have treated, not a lot, but a few people, mainly concussion and then sports injuries. Yeah, soccer injury, baseball injury, hockey injury, and concussion is very common among the kids. So I have treated kids with concussion.
Okay. And say for somebody with a concussion, what would be kind of an example of what to expect from a physiotherapist? Like, would it be more manual release, or would this be a lot of repetitive movement? Like, just an example of what it would be like.
Yes, concussion management is like a wide area. What we do, and otherwise, what people can expect from us as a physiotherapist, when they come for the assessment, we'll do thorough examination and we'll find out they have symptoms. Like some people may have very mild symptoms, some people may have moderate, some people may have severe symptoms. And we have to treat the symptoms and we have to educate the client first and what to expect in the next few days, next few weeks, and then next few months, and when to return to game like the pre-injury level, and whether they are ready to return to play or game immediately or they have to wait for a few weeks. So those kind of education we'll be giving them after doing the thorough examination. And then some people may have headaches, some people may have problem in tracking the objects with their eyes, and some people may have vertigo, some people may have headaches, and some people may have pain in the neck. So we'll treat based on the presentation, manifestation, what they have. So I would say it's more personal therapy, personalized therapy. Okay, so we'll tailorize the program what they need for that particular presentation. So as I mentioned to you, it will range between mild and severe. So we won't give the same exercises for everyone. We won't give the same education to everyone. But there is some comprehensive program available. So I always recommend the kids before they go to any impact games like hockey, baseball, or rugby especially, we pre-screen them before the game, and then after the game, if there is any injury, and we'll screen them again and compare the scores before and after and let them know, yes, you have some potential injury in the brain. So these are the things you have to do, and these are the things you're not supposed to do. And like this, we'll educate them more. And then some people may have some balance issues, some people may have terrible headaches, some people may have dizziness, vertigo, and we have to treat each and every single symptom.
Okay. And I'm sure this is very unique based on each individual patient and what the reasoning is for coming to see you. But how long will you typically see a patient? Like, would it be one session? Would it be 6 weeks? Would it be 6 months? What would that timeline look for an average person seeing a physiotherapist?
Yeah, it's again depends on the condition and depends on the problem. Usually the musculoskeletal conditions, we would do an initial assessment and then we would have a common discussion with the client and what are their objectives, what are their goals in their life. For example, some people will come and tell me, hey Bala, I have pain in the shoulder. I'm not able to reach up a high shelf to pick up something. Otherwise, I cannot use my microwave, which is on top of my stove. I cannot reach for my coffee mug, which is kept on a high shelf. So that would be the goal. So we will work together by giving some exercises, manual therapy and everything. We'll be keep on checking the goal. After the goal is reached, then we'll discharge the client by recommending some home exercise program or activity modification and further education. So this is an example like that. Some people, for example, like a stroke patient, they may need long-term care, right? So if they are able to come to a clinic, like as an outpatient, then they have to come for a longer period of time to reach the goal. And some people may need like positional vertigo, vestibular rehabilitation, positional vertigo. So they may need only 2 or 3 sessions. And some people are like a simple posture problem, which is causing some upper back pain or neck pain. Correcting the posture and giving some home exercise program will correct the problem, will reverse the problem in a few sessions. So it always depends, right? Some people may need a few sessions, some people may need a long-term care and follow-up. Depends on their condition.
Right, right. So when a patient comes to see you for their session, would you also give them homework to do in between sessions or only after you discharge them?
No, between the sessions, definitely they are going to do some homework. That's very important.
I feel like with many practitioners I've talked to, especially from Kawartha Care, they've mentioned that the homework is probably the most important piece to help to progress that healing journey for their patients.
Exactly, you're right. It's like medication, how when they see a physician for any problem, they prescribe some medication. They recommend them to take so many days and so many times in a day. Similarly, we also prescribe the exercises. We tell them the dosimetry, like you have to do 12 repetitions or 10 repetitions, use a particular color band, and you have to do morning, evening, or like 3 times a day, twice a day, or every other day. So we also give them the dosimetry. So the exercise, of course, is a medicine, right? So that needs to be prescribed, that needs to be delegated in a proper way. Only that will be effective.
So as you've mentioned, many patients that you would see and what we've talked about so far is that they would come to you after an injury, maybe an accident or a concussion or a stroke. But would you also see some patients that just have natural wear and tear on their body through age or through maybe doing something in their everyday routine that's causing alignment or posture issues?
A lot, a lot. We are seeing a lot. Especially, for example, like let me answer your last question first. The alignment and the posture issues are happening nowadays in all the ages. Previously, in only one age group. So nowadays, everyone, because of the technology and the time we spend in front of the screen, irrespective of any age, for example, children also spending nowadays a lot of time in front of screen, and even middle-aged people, young people, old people, everyone. We use gadgets a lot. So we have to sit in a good posture. But are we really following that in our daily routine? No, not all of us, right? So we tend to slouch. We tend to like sit in a relaxed position after a few minutes. But the posture is creating major wear and tear processing in addition to the aging process. And also, like lots of musculoskeletal problems are connected. Sure, if you educate the clients about a good posture, in addition to the exercises, they may recover faster than just doing the exercises.
Okay, as you say that, I start to like straighten up, put my shoulders back.
Yeah.
So for our listeners right now, is there just one tip you could give to us to correct our posture right now as we're sitting here?
Yes. So I would tell all my patients, like every half hour or at least 20 minutes, our body will naturally tell us to correct ourselves or change from that position to another position. This is common even when you're sleeping. Without knowingly, we are changing our positions periodically. For example, if you are sitting in front of the computer and after 15-20 minutes, check your posture, how you are sitting. Automatically, your posture would be in an awkward way. That means you may be slouched a little bit. So the first thing what you have to do, you have to correct your lower back posture first. So always when you're correcting a posture, try to sit up straight so that your lower back, the bottom is touching the back of your chair. And then if possible, keep a towel roll just to fill that lower back curve. We call that medically as lumbar curve. So to fill the lumbar curve, keep a towel roll. So that is the base for the whole spine. If you correct the lower back, automatically your whole spine will be erect. And then it's easy to correct your shoulders, to pull the shoulders and roll the shoulders back, and then keep your neck straight and slightly tuck in your chin. Most of the seniors and also the young people nowadays, you can observe in the public when they are sitting, their chin is more poked forward, forward head position. When we ask them just to correct the neck and upper back, it won't work out. That should start from the lower back, which is the stem. So I would always tell my clients, you start from your lower back. So you keep something in the lower back, that is the lumbar curve, a towel roll, which will remind you, yes, you have to sit upright. Then it's easy to roll your shoulder blades back and then pull the head a little bit back by retracting your head. So that is the good posture. Every 15 minutes or 20 minutes, you sit in that posture for a few minutes, and then it's okay to slouch again, and then you come back to that. So that awareness is very important.
That's really good. That's easy. It's just making sure that you remember to check in on that posture every 15 minutes.
Yes. If you are checking automatically, that will become as a habit, then automatically you'll sit up in a good posture.
Perfect. That's awesome. So as a physiotherapist, is there a myth in your niche that you would like to address for our listeners?
Yeah. So there are different reasons behind this myth. People have wait and see attitude, right? So when they get any injury or any problem, oh yeah, it will heal automatically. Let me wait for another few weeks. Let me wait for another few months. So by that time, the condition will become more chronic, and it will take a longer period of time to reach that goal, right? So I always tell my clients, okay, it's okay to wait if it is a simple injury. And suppose if you think you cannot do anything like what you were able to do before, immediately seek some medical attention. It doesn't need to be your physiotherapist. You can go to a physician, otherwise talk to a nurse practitioner, get some help, and then they will guide you what exactly you have to do. Right? So most of the musculoskeletal conditions, people can directly come to a physiotherapist and we can help them. And the wait and see attitude is, it's better now, but previously it was like a major thing. People will think, oh yeah, it will heal automatically. We can wait. Of course, natural healing is possible, but by then you are developing lots of other things in your body. Your body biomechanics is changing, and your loading strategies are changing, and you are getting different problems in different body parts. And the condition itself becomes more chronic.
Yes. Don't wait until it's to the point of too far to correct something that could have been addressed much earlier on in your journey to prevent other issues happening through the body. Would you say that you get a lot of referrals from doctors as a physiotherapist as well, working with medical doctors? Or do you think a lot of people just automatically come to a physiotherapist?
50-50. So nowadays, lots of awareness among the people, like they are coming as a direct self-reference, like they come and say like, yeah, I have some problem and I don't have any doctor's referral. Do you have to bring a doctor referral to see a physiotherapist? No, it's not correct. So the doctor's referral is needed only for OHIP patients. Only if they have to go to an OHIP clinic, they need a referral. But otherwise, if they want to see a physiotherapist in a private practice setting, so they don't need any doctor's referral. But if they have to go through their external healthcare benefits, some insurance companies, they may need doctor's note. So they can check with their insurance companies. And otherwise, we don't need any doctor's referral to treat in a private practice setting. And they can come directly. And nowadays, we can see a change among the people. They are not waiting, and so that the people are coming directly and they have more awareness. Yes, this is a musculoskeletal problem, and I better see a therapist rather than waiting to see my doctor. Yeah, so they don't need always a doctor's referral. Yeah, sometimes if they have undergone any surgery, so a surgeon's note is important. For example, some people might have undergone some surgery, so surgeon may write, this person needs only partial weight bearing on the leg. So that kind of specific notes is important for us, but not always.
Right.
Not for all the other clients. Yeah.
And I talked to many of your other coworkers at Kawartha Care Clinic as well. And what was really amazing is that they mentioned if you're calling the Kawartha Care Wellness Center and talking to the front desk about kind of what's going on, they can also help you decide whether you need to see a physiotherapist or a chiropractor. And sometimes it's both, but they can also help you choose which is the best option right now for your condition too.
Yes, that's correct. I think the front desk is amazing there. So they are helping them. And also they are giving them the choice. They are not taking people's decision on their hands. They are giving them choice based on their compliance and based on their condition. And it's up to the clients that they have to choose whatever service they want to do. Yeah.
Fantastic. So you as a physiotherapist, I'm sure prioritize your wellness journey and making sure that you're living the healthiest lifestyle that you can for longevity, for making sure that you can keep up with your patients. So can you tell our listeners maybe something that you find that's tried and true along your wellness journey that really makes you feel good to enhance your health?
Yes. I prefer to eat at home in the sense we don't need a lot preserved food. We eat fresh made every day. We cook at home, homemade food, and I'm a vegetarian, and I like that. And also regular exercises in terms of yoga. I do everyday yoga, so that is helping me. And then good food, natural food, and organic food, vegetarian food. That's my path.
That's amazing. Food is really its own healing modality in itself. So
That's correct. Yeah.
It's great that that's one of your biggest priorities for sure.
Yeah.
Do you do all types of yoga or?
I used to do lots of poses, like a hatha yoga poses, starting from sun salutation to pretty much all the meditation, everything. But now I do every day in the morning, half-hour yoga. So that is called as Shambhavi Mahamudra. That is the name of that yogic practice, which I do every day for my health and wellness.
And you practice meditation as well too?
That includes meditation too. In that half hour, like a part of poses and part of meditation too.
That's great. So who or what are some of your biggest inspirations and why?
Biggest wellness inspiration is my father. He is 76 now and he's still active. He's walking every day at least 10K, and he's eating only vegetarian food, and he's doing every day some kind of physical activity. Yeah, so he's my inspiration.
That's amazing. I love when people mention their parents. It's just, it's such a heartwarming inspiration for sure.
Yeah.
Okay, Bala, so you're stuck on an elevator or in any type of room with somebody and you have the opportunity to give them some advice from a physiotherapist. What would be 3 things you could give to them to implement into their wellness routine starting today?
Wellness routine, number 1, regular physical activity. Even though they are not able to do any routine exercises, at least walking is good. And nowadays, especially young people, like they are sitting a lot in front of the gadgets or in front of the screen, and lots of researchers, they confirm that sitting is like smoking now, and equally dangerous like smoking, which is affecting our cardiorespiratory efficiency, and people are in trouble in terms of exercise intolerance and lack of endurance and weakness in the muscles and other biomechanical problems and musculoskeletal problems. So the important thing is exercise routine or any kind of physical activity. And the second thing is have a very good posture. If you have to maintain a static posture in your work or in your daily life, and then good food. good food. So these are the three things I would recommend them.
Perfect. Those are three really impactful things that are, I would say, the foundation to a healthy wellness routine, but also longevity. And that is really should be everyone's goal, is living life as long as you can in the most healthy and sustainable state as you can. And those are three big game players to make sure that you can reach that longevity stage.
Yes, you're right. Yeah.
Well, that pretty much wraps up this podcast, Bala. I want to thank you so much for sharing your wisdom on the episode today. I know that our listeners are going to be sitting back, putting a towel at their lower back and rolling back their shoulder blades as they hear you speak on this podcast. So thank you so much.
You are welcome, Marisa. Yeah, thank you so much. Thank you for having me. Yeah, thank you.
Thank you guys so much for tuning in. Please be sure to like, subscribe, comment, and share on social media that you're listening to the Wellness on Purpose podcast.